This is the Emergency Medical Minute, sponsored by Health One.
All right, good morning. So I was also going to talk a little bit about sepsis and, like Hale was saying, sepsis bundles, there are certain parts of it that are clear and do definitely help patients. Antibiotics, the earlier, the better, especially on the sicker patients, severe sepsis, septic shock, getting antibiotics started early definitely is important. And, with help from, everybody, nurses, pointing out, this patient has an elevated lactate of 4. Can we get those antibiotics going? Kind of the sooner we can get the orders in, the sooner patients get the antibiotics, better off things are in the long run, initiating those bundles. So, if we're busy and kind of overlook an elevated lactate, definitely letting us know that we should probably initiate those bundles. I was also going to talk a little bit about just a little nuance and some controversy with some fluids and pressors that are kind of on the horizon. So, yes, the 30 mLs per kilogram for patients with septic shock is still a core measure, still something we need to do, but there's kind of more kind of evidence and thought that maybe not every single person benefits from those, 3 liters potentially of fluids. And there's some thought that, when patients are really sick, they have, a lot of inflammation, and that inflammation can lead to a lot of capillary leak. You've probably seen this where some patients just start getting more and more bloated, edematous, fluids are going into the lungs, and, maybe not everybody benefits from those IV fluids like we think they do. On the kind of the other side of that is that pressors, we used to think, we shouldn't start pressors till someone gets their full 30 mLs per kilogram. And, if their pressure is, 75 over 40, just keep giving them those fluids until they get to their full 30 mLs per kilogram. But now there's definitely some thought that starting pressors earlier is fine. This idea that you have to fill the tank before you give pressors might not be, actually a thing. And that if you have somebody whose blood pressure is crappy, they're not mentating well, they look sick, we don't need to wait for all the fluids to go in before we start giving pressors. They probably benefit from getting their blood pressure up sooner with pressors, and that's where I talked about peripheral pressors. Starting peripheral pressors is probably okay as long as someone has a decent IV. Getting those pressors started early is probably beneficial through a peripheral IV. And what we can do is, we can give the fluids and then we can back off the pressors. And if they don't need the pressors anymore after they get their fluids, great. If they do need pressors, then we continue them on them. So yes, antibiotics early is good. Starting the fluids is good, but if somebody really has a low blood pressure, they're not responding to like the first, even 500 mLs of fluid, we should probably think about starting pressors early on, kind of seeing how they respond to a combination of pressors and fluids at the same time. Any questions? Thank you.
We are on a quest to provide the world with free medical education. Please help us out by rating us on iTunes, following us on social media, and subscribing to our newsletter at emergencymedicalminute.com.